Well, in our morning rounds, a new warning about sugary drinks. A Harvard-led study in the journal Circulation found people who drink 2 or more sugar-sweetened beverages a day had a 31% higher risk of early death from cardiovascular disease. Each additional soda, sports drink, or sugary beverage increased the risk by 10%. Our Dr. Tara Narula is a cardiologist at Northwell Health and joins us with more on this study. Tara, great to see you. So we know sugary drinks are not good for us. What does this study tell us in further detail?
Well, previous research has shown that sugar-sweetened beverages are associated with things like diabetes, weight gain, heart disease, and stroke. But what we didn't really look into was the increased risk of mortality or death. There have been very few studies that looked at that. And this research really did show that the more sugar-sweetened beverages you drank, the higher your risk of death, primarily from cardiovascular death, but also from cancer death as well. And so researchers looked at essentially 2 studies, one of about 80,000 women, one of about 30,000 men, who were followed for about 20 to 30 years. They gave them questionnaires to ask how much they ate and drank, what their health and lifestyle factors were like. And they found that in those who drank about 1 to 2 sugar-sweetened beverages a day, the risk of death went up about 14%. Over 2 drinks per day, the risk went up 21%. Now, again, important to point out, this is not the kind of study where we can say cause and effect. It is an association that they saw, but definitely, again, adding to this body of evidence that sugar-sweetened beverages not so great for our health.
What about a diet soda?
So that's a great question. A lot of people want to know the answer to that. And the American Heart Association actually last year came out with a scientific advisory saying that, look, that can be part of a healthy diet, especially for those individuals who want to cut back if they're drinking a lot of sugar-sweetened beverages. This study did look at artificially sweetened beverages and found that there was no real increase in mortality unless you drank more than 4 of these drinks a day and you were a woman. And so they need more research to look into that female effect. It may have been that women who were overweight or obese were trying to switch to artificial sweetened beverages, and they were already at high risk.
But why was it higher in women? Do you think it's because of weight? Is that what you're saying?
So this research in general, in terms of the sugar-sweetened beverages, did show an effect that was higher in women. And the researchers were quick to point out that we don't know why. It could be that the biology of women is different, how we metabolize these drinks are different, our physiology, or it could be the methodology of the study, that women tended to report their drinking use differently from men.
The American Beverage Association did not respond to our request for a comment, but their website says that soft drinks are safe as part of a balanced diet. Do you agree with that?
You know, the lead researcher even of this study said, look, if you're drinking 1 or 2 soft drinks a week, probably the incremental increase in risk is very small. But what we know is that sugary sweetened beverages are the leading cause of added sugar in the American diet.
This is even cocktails at night, right, that have sugary
coffee,
components.
teas, sports and energy drinks. The fact of the matter is Americans should be consuming, for men, about 9 teaspoons of added sugar a day. Women, 6 teaspoons. On average, we consume 20 teaspoons of sugar a day. And when you look at a 12-ounce soda, for example, that has about 10 teaspoons. So with 1 soda, you've already gone over what you should have, consumed for that day.
So what are we left with? Boring water?
We're left with boring water, seltzer water, sparkling water.
I don't like the bubbles.
Boring.
Okay. Healthy water, fresh water, okay.
Yes.
She smiles her way through it.
Read the labels.
Taking away all my happy places.
I know. Dr. Narula, thank you so much.
Thank you.